I'd just like to start by saying, or acknowledging the Gadigal people of the land that we're on at the moment, and then the Wadi Wadi and Dharawal people, traditional custodians of the land on which the new Shellharbour Hospital will sit. It seems to me that the AHDC know what they're doing in curating a presentation, because it feels like we could have been part of that panel. We could have been discussing the building that we're about to show you. There's a couple of key themes I just wanted to pick up on, and you'll see in the presentation. The first is place, and obviously designing with country, but this idea that the panel discussed of listening and not having preconceptions about what will come out of a process. And the second is how important it is to have cultural authority to proceed. I don't know if you have, working with Geoff Greenaway down in Melbourne, it was a really important thing. So hearing a story, absorbing a story, reflecting on it in architecture and design, and then going back and getting authority. So maybe just a quick who are we? So Cox is a design-focused contemporary architectural practice with studios around Australia.
So Thomas Hanley, we pretty proud to basically just focus on health the last 45 years. And we have offices all around Australia, and we've also worked overseas. And I think probably more importantly, Cox and STH, we've worked together on a number of projects now, such as Wollongong, Bulli, New Shellharbour and Warrawong, and really enjoy it.
Loving it. So we're working obviously for Health Infrastructure New South Wales, and our health partner is the Illawarra Shoalhaven Local Health District. For those of you that don't know, Illawarra Shoalhaven is an enormous local health district spreading basically from the South Sydney all the way past Milton, Ulladulla. The little square that we're in is the kind of focus of our project. So in the context of a changing community, that area and all of the purple is currently rural land rezoned for 58,000 new dwellings to 2041. So that gives a bit of context for why a new public hospital in Shellharbour. It's part of a suite of projects, including the new Shoalhaven Hospital as well.
So what are we doing? I mean, I think the intent was to provide self-sufficiency as a hospital serving its local population and taking the pressure off Wollongong Hospital. It's essentially a greenfield hospital, which has got general medical, surgical, hospital with elective high-volume surgery, a large expanded mental health precinct, ED, ICU, and also provision for outpatient and inpatient rehabilitation. And there was a really strong emphasis on digital health and virtual care to patients. And also we knew even from the very start that there was a really strong leadership from the project team who had just come through a similar design process at Shoalhaven, and they were already bringing those lessons learned.
Just some key metrics there.
Yeah, 220 beds, 40,000 square metres, and 1,000 cars.
And Mungo, the challenge is to work out which typology it is, which blend it is.
And 6 years, starting with COVID.
Exactly. So where is it? It's about an hour and a half drive south of Sydney. It's in an incredible location, I can't emphasise enough, between the Illawarra Escarpment, and those of you that know south of Sydney, it's this incredibly dominant, beautiful feature down there, and then also the ocean. Connected by a train line to Sydney, it's a major growth corridor. So when we started the project, there was an existing project vision statement, which was, from the escarpment to the sea, the new Shellharbour Hospital will be a safe, sustainable and inclusive place to connect the community to health services, enriching the lives of people in our region. So with the site that we've been given and that kind of a vision, like what a challenge to be set. Just some very quick things about the site. On the left-hand side, yes, your left-hand side, predominated by the ocean and then the Minamara River, which you can see stacking through a wetland, and then in the foreground by formerly rural agricultural land. On the right-hand side is the Illawarra Escarpment and the kind of foothills that lead up to it. What I want to point out on the left-hand side, the image on the left, is the little bump in the distance, which is Mount Kira, just adjacent Wollongong. And then on the right, the Port Kembla headland.
So for all the architects in the room, you're probably pretty familiar with these design principles. So these are best practice and inherent in any health project. Hospitals, I guess in our opinion, need to function well, be flexible, have really good connectivity, be safe for staff and patients. And promoting physical, emotional, and spiritual care through a therapeutic environment is paramount. But finally, connection to country and of the place should really be embedded in the design. So, what we did we had a vision workshop. That was our first thing. And we presented these principles in our projects that were just shown before on the previous slide at a vision workshop, which consisted of the LHD, the executive, the clinicians, and feedback from the consumers. And more importantly, once we presented, we stopped and we opened it up for discussion, and then we listened. And this slide was captured. So all the themes here was actually captured by a graphic artist during the workshop as a summary of the community and hospital vision. And some key themes emerged here, which you can sort of read on the slide. That really what they wanted was a precinct for the community and not just a hospital. They wanted rooms with a view. They wanted sounds of nature and connection to gardens. They wanted new ways of working with hardly any offices, multi-purpose flexible use of spaces, engagement and inclusion with country, cafes, meeting spaces, recycled water, electric car charging, enabling future growth. And then they started even getting into the idea of sort of built forms, such as ideas of triple hut atriums and ease of wayfinding. And this essentially became our brief to provide a health precinct for the changing community.
And having been given a brief, as with any architectural project, you have to start by kind of looking at the place. So this was our first task before engaging with the connecting with country process. So as we mentioned before, the place is dominated by the escarpment, the land, the sea, and the interaction between all those elements and a kind of former agricultural use. The other key thing that you take away from this landscape is it's almost, magnificent horizontality. So be it by the sea and that, lovely blue flat horizon, or the escarpment itself. And these are really front of mind in our imagination as we're working through the building. The second is you probably couldn't pick a worse site for a hospital. You might not be able to read the contours, but the very top is at 45 and the very bottoms is at 5 metres. So why don't we put a hospital on farmland on a triangle-shaped site with 45 metres of floor? Great idea. So naturally, we had to start thinking about how a project might end up being embedded in landscape. And the image on the left-hand side is of the Minamurra wetland.
And I guess important in any hospital is the design of the inpatient unit, and this was of key importance in both function and form. So, it's interesting. I mean, you've seen a lot of these. You've seen a lot of the typology of the urban. We call it the urban design, the linear design, or half an H wing. So we did explore that because that the health infrastructure, wanted us to explore that, and then we looked at the more organic approach. And what we landed on was the more organic design because ultimately it had thinner wings with more beds per floor and hence more access to daylight. It had better views to the escarpment with 71% uninterrupted views, no internal views to other beds, and it essentially met the brief of the rooms with a view. And these are the views. So I think we can stand already today and say every bed will get this view.
Every bed.
Yeah.
So again, back to the issue of the triangular site. We looked at putting it at the top. We looked at putting it at the bottom. And lo and behold, we landed on the middle.
Surprise, surprise.
Surprise. So most of the reason for that is actually it's the flattest part of the site. There's still some pretty major stepping, and it also gives us an opportunity to expand both up and down the hill.
Okay, so this pavilion design, again, fortuitous. We've seen a lot of people talk about this already. So we did about 30 concepts for master plan, and we narrowed it down to about 3. And the first one was the urban form, which was very linear, again, fairly familiar in urban hospital designs, but very agnostic of the context and a lot of internalised views. So then the second one was the topographical. So we went probably about the complete extreme and thought, why don't we put a very, very large singular clinical podium that created a beautiful large green terrace with some exploration of some triangular wards on top. That what we found is that it had significant travel distances, a high facade to floor ratio, and was essentially too expensive. So what we landed on was organic, and we've just talked about it. So we were like, yes, organic, which is our adopted master plan. And the beauty of this one was we did the 8.4 by 8.4 grid. We've got standardisation and universality, but it's a more compact building form. It optimised all the travel distances for the users. We aimed for a 60-metre radius from front of house to each department, but it has fantastic improved views. It engages with the landscape and slope of the land. And we had a really good connection to a mental health precinct to the left. And we really tried to use the land as much as we can, the slope of the land.
So having gone through a bit of a master planning and massing phase, the connecting with country process then started in earnest. And we came into that process really with some core principles or really aspirations. So to connect with natural contours, to celebrate watercourses, views, make connections to landscape at multiple levels. So these are themes that we've heard a few times, which is good, means we sort of got some part of it right. And also to integrate spaces that make reference to the original markers on or in the vicinity of the site with historical significance to country. I want to make a special mention of Yarrabingan, who obviously are not presenting with us, but who coordinated the connecting with country process. This is one of their documents, which is a sort of everything on one page piece that captures all of those conversations. So in particular, local stories, local planting, the importance of journeys through the site, and the 5 blobs. And I want to get to the 5 blobs, which is a very important local story. And it's the story of the 5 islands. So the story goes, and this is a paraphrasing, but one we've used before, so I feel like we've got authority to use it. That Ullabullawu, the West Wind, and his 6 daughters, Mimosa, Wilga, Lillipilli, Wattle, Clematis, and Gira, lived atop a mountain surrounded by an ever-changing meeting point of sea, land, and sky. One by one, the daughters misbehaved and were cast out to sea, where they became islands. What a dad. The youngest daughter, Gira, then didn't have anyone to play with, so sat longingly looking out to sea at her sisters. She eventually turned to stone and became the escarpment that is now Mount Kira, and that is the 5 Islands dreaming story.
Actually a happy story.
It's a story about the sisters, not the dad. So this sketch, you might think looks quite familiar given the master plan massing that we showed, but the table producing this sketch had no knowledge of that design. So the 5 Island story, kind of like these things do, got a life of its own within the workshop sessions, and this is what came out. So we then turned that married that with our kind of previous massing concept. And the key thing here, and you might struggle to read it because I am, is identifying the Gira headland, each of the 5 islands, a key place of welcome and gathering spaces throughout with connections out to country. Progressively, we worked up the idea, and a lot of this is about, and Brad mentioned, teasing the mass apart to create as many connections out towards views and land that we can. So there's a massing sketch which then evolved into an architectural sketch. The key thing I want to point out in this sketch is the idea of the central meeting space, the covered welcome lounge. But 5 Islands didn't stop there. It wasn't just 5 building masses. It was also a landscape concept. So in this you can see Clematis, Wattle, Lillipilli, Wilga, and Mimosa as 5 separate climatic zones that might be appropriately allocated across the site. And thanks to Taylor Brammer as well for these. So I wanted to show you an evolution of sketches. So this is an early sketch of all those elements coming together on the site. I will say at this point that the 5th island did get value managed out.
Yeah.
Which, some might say is a limiting part of the design, but we do have a pre-prepared interior design scheme and a few calls ready to receive the 5th island. And this is our SSDA approved scheme. And again, the things that I really want to point out to you are the Gira garden at the very top of the hill. So we use that high point that we mentioned. Now what you're seeing is a truncation of the larger triangle. So it's the middle section of the site, but still at the very top of the site, we have a Gira garden. A slight digression, it's also in a bushfire zone. So again, all these constraints that you have on picking sites in a rural context. The challenge was by the government architect to find 40% canopy cover. So we set up a diagram that showed as much as we could get with all of the terrain constraints, subtracted the building, and then all of the road network and car parking, and came to 29% canopy coverage, which is a pretty great outcome for a hospital campus.
Now, this is a really busy slide, so I'm not expecting you to understand all of it, but this was sort of our final block and stack. And I guess importantly, it is, it's a familiar form. It's got two levels of clinic with a clinical podium, with a perioperative suite and back of house at lowest level, and then ED and medical imaging above that. And importantly, both those floors connect discreetly to the mental health precinct, which has its own entry. Level 2 is the main entry floor. And so people arrive, they go through the between the ambulatory care building into this beautiful open welcome hall, welcome lounge. And this is the floor where we have the whole of hospital new ways of working, we have education, we have cafes, the large terrace, and also the Aboriginal family room front and centre. And then working our way up, we then have 3 floors of pairs of standardised inpatient units. Mental health, yeah.
Anyone who's worked on a mental health building, they are ferociously complex, little bits of overlapping program. Suffice it to say, the building is a courtyard form comprising a lot of smaller courtyards. So each of the units has their own courtyard with, you could sort of see on the program diagram, living spaces surrounding those outdoor spaces. And then there's a series of sensitivities between them to try and obstruct views, but also create views out towards landscape. So the courtyards at the very kind of the final diagram, every single one of those has either got a view out towards landscape or to a courtyard.
And I think I probably, again, it wasn't really clear on the block and stack, and it's hard to sort of explain, but essentially every single level, because we've essentially followed the site and cut into the site, every level, every theatre has a view, ED has a view, the inpatient units all have garden, elevated terraces, and mental health all have views and they can get out into the... So the intention is that everyone can get out and touch the landscape.
This will probably be the last presentation where we're looking at just at the building, because when it gets built, we'll have photographs of the views from the building.
So,
in terms of how the 5 Islands then became a facade narrative, we did a series of studies of effectively from the water line all the way to the canopy line. And you can see those studies on the right-hand side, different ways of abstracting the idea. We took these studies back to our Indigenous working group and workshopped them and landed effectively on the version on the very top. We developed also, as you know, hospitals, particularly the hot floor plates, those lower 2 that Melina mentioned, have got lots of different openings, plant roofs for any type. So we developed a sort of suite of facade expression to deal with each of those conditions that you can see in that kind of angled diagram. And that's how it ended up being articulated on the form. One of the things I want to point out here is, and if you look at the elevation on the bottom, how we go from 2 stories on the northern part of the site up to 7 as we go down the hill. So really embedding a curved building into the landscape. So thanks, Tracy. The 5 Islands also became interior schemes. So we have 5 individual inpatient units, and then, like any hospital, a need for a base palette. So we had the geology and shoreline palettes to go. We then allocated those. There's a colour study that sits behind it, but we allocated them according to the kind of appropriate uses. So, for example, Lily Pilly being an active colour palette in the ambulatory care centre. This is that welcome lounge. So it's views out towards the east and the west. And as you enter on access on the left-hand side, past reception, you can see through the built form out towards the escarpment. And then just some simple examples of how those colour schemes then are applied in inpatient units on the right and mental health lounges on the left.
Keep going. It's work in progress. We're at design finalisation, so we had a pause for about a year. We've got a contractor on board and we're re-engaging with everyone again. So
the curves are still in there. Don't worry.
Haven't been belly managed up.
So this is a view elevated above Dunmore Road, which is our primary street frontage, and you can see the escarpment in the background. Where you descend down just out of shot on the left-hand side to the public arrival at ED, and then also on the right-hand side, the ambulance apron. mental health is on the left of shot. And kind of swinging that aerial view around toward the north, this is the ambulatory care building across the front with the arrival and drop-off sequence with the inpatient units behind. It was really important to us that the arrival feel like a regional hospital, not like a kind of urban hospital. So very much dominated by landscape.
Yep.
And this is the arrival across that kind of sublime curve across the front. You can see a multi-story car park in the background. Just a simple view. You've already seen this one down of ED. If you can wrap up your presentation for the Q&A. Okay, noted.
Oh. I think it's important. I mean, again, you can see that we did have separate entries for ED at the lower level, which you saw there. So we've got that really good separation of public arrivals. And this is the
pretty significant building from the south, right?
the beautiful landscape gardens that hopefully we can afford.
The last two, this is just a bit of a dusk shot because why not?
Yeah.
And then showing the kind of key lounges at the end of the IPU wings with views out towards the escarpment. That's it. Thank you very much.